puppies, won't you walk with me? I'm the puppet dog.
Having me tonight on the show. I'm super excited, and it is an honor to be here with you. So my journey actually started probably in a similar fashion as yours, from what I recall, meaning it is rooted in personal experience. So it started with my dog Pepsi, who suffered from osteoarthritis, and I wanted to find a way to help him feel better and add to his treatment that wasn't just NSAIDs or more traditional medical, basically, tools. And so that led me into the world of alternative therapies such as massages, physiotherapy, and also the world of supplement, which I was very surprised to learn is actually not regulated. And although there are multiple products out there, sometimes it feels like it's very hard, even as a veterinarian, to navigate that world. And so through my learnings with Pepsi and discovering ingredients that outperformed others, I just felt that as a veterinarian who's passionate about helping animals, that I wanted to really create products that people knew they could trust, that was rooted in science. And it started with my dog Pepsi. So what I am creating today with Jope, which stands for Joy of Pets, is really a tribute to Pepsi, who's no longer with me, but who I think about every day. And so through helping other dogs, I, help Pepsi's memory. And so that's why, I'm very happy to be here today. And it means the world to me to be able to talk about Jope.
Wonderful. And I'm sure that many people can, have shared a similar journey and gone through these things. I wish we knew, I think about it, but we should have had a picture of Pepsi here. So thank you for sharing
I have many.
the story. We would have loved to have seen Pepsi. Pepsi was a boy, or?
Yes,
Okay.
he was a boy. And I did want to call my company Pepsi for a while there, but then I figured I might have some trademarking issues.
Yeah, maybe just a few. Yeah. Well, thank you so much, because so many people struggle with this with their pets. And, let's just dive into it. Let's talk about some myths. Can you share with us some insights into common misconceptions about osteoarthritis and just joint health in dogs? And I know we're kind of talking about dogs as the focus, but this kind of also applies to cats too, right? Or
I think so too. Cats are obviously different from dogs, but overall, I think the different points we will be talking about tonight can be relatable for cat parents or dog parents. And cats, kind of the overall takeaway between the difference with cats and dogs is that cats are just even better than our dogs at hiding anything going on with them. Yeah. So whenever I will be referring to subtle signs, you can just kind of imagine your cats being even more discreet in displaying any signs or symptoms that something isn't going well for them, or that they're not feeling great.
Yeah, they do. They hide stuff. And
Yes.
sorry, at the beginning, everybody, they told me in the chat that my volume was kind of low. I also see I'm kind of going, I don't know, my camera's like adjusting, and I'm getting kind of like a little blurry and then not. I don't know what's going on. There's always the demon of YouTube on my channel. So, okay. So I also want to say hello to everybody in the chat. Thank you for letting me know about that issue. And oh yeah, so you have a kitty who's 14 and your dog Joe is 9. Okay. So yeah, I have a 14-year-old cat myself and a dog who is 9 as well. So these are big concerns for pet parents as our pets get older. But we do have this issue that we want to talk about tonight, that these issues aren't just affecting older pets, right?
Yes. So one of the myths, you were asking earlier, one of the myths I think is truly that arthritis or joint disease is something that affects senior dogs, and that is also normal. So there's a tendency to believe or to expect that when our dogs or cat get older, they will slow down, they will be achy, and they won't be able to be as mobile. But that is actually not, a reality. they should be able to age and feel well and still be able to get around, potentially a bit slower, but there's no reason for them to have to suffer. Joints can remain healthy. And so it's not something that just comes with old age, and we shouldn't give up and just accept it. There's a lot of ways that we can help them feel better. So I think that would be, myth number one, is that if you're getting old, your mobility is going to be less good than it was when you were young. And that is not true for cats, dogs, and for us humans too. And the other one I would say is also that most people believe osteoarthritis is disease of the senior dog, or at least older dogs and cats. But there's actually a lot of dogs, young dogs, that can have joint issues and osteoarthritis. So there's actually data showing that 2 out of 10 dogs, over 1 year of age will have osteoarthritis. And then that number does jump to 80% for dogs over 7 years of age.
Wow.
The data for cats specifically is a bit harder to find, but I would expect to have similar numbers. Again, cats are just, very good at hiding that they suffer. And so it's even harder for us veterinarians or pet parents to pick up on their discomfort.
Wow, those are some pretty high numbers. So how does early intervention and just being proactive about joint health help? What can be done?
So number one is, starting to think very early on about what you're feeding your dog and your cat. So healthy diet, healthy balanced meals, working with, ideally a veterinary nutritionist, but at least talking to your veterinarian and trying to adapt the feedings and the food you're giving to your dog or cat based on their activity, their breed, their size, and also if they are prone to any diseases potentially. There's also activities, so keeping your dog active throughout their life, whether they're very young and they have a ton of energy, or there's more senior, like maybe your pup, who I saw go by a bit earlier. So, around 9, they might not be able to be as active as they were before, but they still should be going around and exercising to keep the joints healthy. And then, some other things that you can do is also be mindful of the environment your animal is living in. So for example, puppies, if they're, smaller breed dogs, maybe try avoiding having them jump up and down like couches or cars, so you can help them up. Because when they're young, although they have a lot of energy, their growth plates are still not necessarily fully closed, and they can be very fragile. So that could be an example for young puppies of, things to avoid with them. And as they get older, you can also, for example, if you have a senior dog that is struggling to get up, one thing you can do is put some gripping material. So whether that's, a rug or something that they can really grab onto to get up, so that will help them feel more comfortable throughout the day.
Yeah, we had to do that. We had to get some like runners. We have hardwood floors in here,
Yes.
and we had to, put those everywhere. I don't know why my camera's doing this. It's almost like a focusing thing it wants to do. I don't know. It doesn't matter, but oh, thank you. Well, that's okay. You didn't put their names first. So Oreo, Slippers, and Knucklehead. Okay. And
those are great names.
Yeah. Oh, and here we have sort of a question. Like Dachshunds I've always heard hip and spinal issues. So breed specific, like
Correct.
their structure. So you kind of touched on that, but what can, if people start young, what can sort of be offset? Like, what do you see for people who are doing things when animals are younger versus sort of not doing anything, not intervening when they're young?
So, it's, I guess one of the challenges with arthritis is actually that if your dog is meant to have it at some point in their life, you're not going to be able to prevent osteoarthritis from settling in, but we can delay the time where the symptoms will start appearing or where our dogs are going to feel less comfortable. So we can actually delay the time where symptoms are going to appear, and you can slow down the progression if your dog is diagnosed with osteoarthritis, for example. This is where supplements can be, a great thing to add to your dog's diet because they're safe, and when chosen carefully, they can be effective. And more studies are being done on supplements too, which is where we really started. So, since the past 20 years, there's an interest in supplements, whether in the human world or veterinary medicine world. So there are studies supporting efficacy. And by having a healthy diet, exercise, adding supplements, you can help delay the time or your dog will have symptoms, or you can also slow down the progress if your dog is already diagnosed. And same thing for cats.
Okay, and what kind of diet do you recommend?
So that is something I think is tricky. When it comes to diet, I am personally not a fan of a one size fits all approach. So I wouldn't want to say this is the diet you must consider. I think it depends, first of all, what can you do as a pet parent? How much time do you have? Sometimes a home cooked meal can be great if it's balanced, but you might be working all day and simply not have the time. So I prefer to say that, diet should be something you need to think about, what makes sense for you in your daily routine, and what are the needs of your dog as well. I know raw is popular, home cooked meal is gaining in popularity too. Kibbles, some people still use kibbles. Sometimes it's just a necessity, I guess. So I do think if thinking about just feeding your dog, it has to work for you. And the most important is to have a balanced meal and balanced diet. And I think consulting with your veterinarian to see where your dog is in their life. So puppy, adulthood, or senior dogs might have different requirements. And I just think, staying educated, speaking to veterinary professionals will be the best way to care for your dog when it comes to nutrition. And nutrition is hard. It's not something very easy. I don't know what you recommend, Anne, but I just feel like it's a tricky one, and people have a lot of opinions too.
Yeah, it does get kind of crazy out there. I mean, I like you mentioned, I'm a fan of whole foods as much as possible. And I understand too that, people sometimes struggle to really be able to feed their animals the best, organic, grass-fed, whole foods. It can be hard. And I'm not trying to dismiss that or judge anyone for that. I think if you can do that, it's great. I feed my dogs raw. At the same time, I also add warm water to it, just from a Chinese medicine perspective, because that's kind of what as far as nutrition goes, that's what I've studied it from. And sometimes, depending on the animal, it's not so good to give them like cold, raw food, especially at certain times of the year. So but I do buy a store brand. I don't have the size kitchen and the things you need to really do that well. We did try making
That's
the cats. Yeah. And the time, I'm not the best cook to begin with, so they might rebel if I made them their food. But we were trying the crock pot with the cats, and it's funny with cats because that's a lot of work that you put in, and one of them kind of liked it for a while, and then cats are so picky, and then they got turned off of it, and we're just going around and around. I've been using I did try a brand called Viva Raw with them, and for a while they loved it, and then they get turned off, and then they were having some tummy hairball issues, and we're trying to get that on track, and so then we had to go back to the can. And cats are, to me, when it comes to food, dogs are, for me, great. I have no problems with my dogs, excepting I can give them anything, but the cats, that's another story. It gets kind of challenging. So you switched Joe to grain-free. Oh, and he lost weight quickly. Yeah. Yeah, the stuff I give is grain-free too. Yeah. And what I realized, just to kind of backtrack a little bit, maybe not everybody totally understands what is osteoarthritis and what are we talking about when we're talking about joint health. Maybe you could.
So it's a type of a joint disease where there's inflammation in the joint and destruction of the cartilage. So the cartilage is like this cushiony structure in between two bones. And when we move, the bones do not touch thanks to this structure. But when there's osteoarthritis, the cartilage breaks down, and there can be over time bone to bone interaction leading to pain for the animal, the like human or anybody experiencing this basically. So that's what it means. Osteoarthritis is the destruction of the cartilage within a joint, and that can happen because of a lot of different causes. So there's not one cause for osteoarthritis, but there's many different reasons that it can happen. Certain dogs and cats will be more prone to osteoarthritis if they had, for example, a joint issue, a fracture, if they're very active, or have a breed with predisposition, such as German Shepherds, Dachshunds, many more actually, golden retrievers, Labradors, or Corgis or Frenchies. So just a lot of different breeds, and probably more than we would expect.
It's so interesting. Like, what is it that goes on there? Or what, and I know people try to have been trying to change you. I'm a German Shepherd lover. I have a German Shepherd, and I know they've been trying to stop some of the breeding that's contributed to that, luckily, thank God, over the past few years. So and by the way, if anybody has questions, feel free to post them. And I'm so glad that you do listen here all the time, Pointer Lover. Thank you. I think I've seen you in here before, so thank you, though, for being here. And everybody who's watching, I know not everybody wants to post a question or post in the chat, but we love to have you here. And if you are watching this on the replay, please feel free to comment, let us know, just what's going on in your pet's life, if this is helpful. And we like to hear from you. So post, share, like, subscribe, all those good things. We appreciate them all greatly. If you could tell us a little bit about what you've been working on, you seems like you've really kind of gone in a direction of this has been your focus, and that led to Jope. So maybe tell us a little bit about that and what's Jope? Joy of Pets.
So yes, Jope stands for Joy of Pets. What we want, as all pet parents probably want for their dogs, is really help them live a longer life, but not just longer, also healthier, because quality of life matters. And so recent studies, as I was saying earlier, are showing that supplement can be beneficial for long-term health, especially in the area of mobility. There are ingredients out there that nowadays are becoming more popular, such as UC2 collagen, with robust data and studies behind them supporting benefits. In the case of UC2 for senior dogs with OA, so OA stands for osteoarthritis, but also younger, healthy dogs who are very active and might have inflammation due to normal daily activity. And so the reason we wanted to really focus on mobility is because if you cannot move properly, many other health issues might occur. So we felt that by starting somewhere that was precise, but also helped overall maintain a healthier lifestyle and helped with overall health, it would be a good place to start. And so that's why we went in the mobility category with a joint supplement to start, although it is a very crowded market. However, we stayed cleared from glucosamine and chondroitin because studies are showing that these ingredients are no more beneficial than a placebo, unfortunately. And we decided to select 3 ingredients with scientific data to support efficacy. And we actually launched a double-blinded placebo-controlled trial with a very well-known animal hospital in the US that will include 60 dogs, and we are comparing it to placebo.
Oh,
and
wow.
we're also using ground force plate to make sure we have an objective measure of the improvements our supplement can bring to dogs that are in the study.
Now, what is that ground force plate? Is that what you
Yes.
said?
So it's a device that is used in studies and also in rehabilitation center. It kind of looks like a long yoga mat, and dogs walk on the mat, and there's electrodes that are measuring the pressure applied to the limbs. If a dog is painful, they cannot apply as much pressure on their paw, for example. So the captor will show a difference of pressure, and that's something we measure. And you measure it at the beginning of the study and at the end of the study. The benefit to using a device is that there's no bias, because a computer cannot, make an error. Basically, there's math behind it and a calculation which leads to conclusions that are objective. And that is something, when you're looking at studies for supplements, that is really interesting to look at. If you're able to find studies with a device instead of human measure points, it gives you more confidence in the conclusion that you're able to see. So UC2 has a ground force plate study with positive conclusion, and omega-3s too. So those are two ingredients we decided to include
Okay.
because of it.
Okay. So glucosamine. This is, I mean, that is something that everybody just kind of says, oh, I give my dog glucosamine, I give my cat glucosamine. The vet says to give him glucosamine, and it's in all these like aging or whatever, joint health supplements. So let's just go back to that. You said that there's really no evidence showing that that's effective. Wow. Isn't that crazy?
So no more effective than a placebo. So I didn't say it wasn't effective.
Okay.
I said it's no more effective than a placebo. And that is a difference because people don't realize that placebo effect exists in dog. When you look at studies on glucosamine, there's a review that was done in 2022 that actually looked at all the studies done in the nutraceutical space, and they compared the different ingredients and looked at the different studies, and their conclusion on glucosamine and chondroitin is that there was strong evidence of non-efficacy. So that is something. Important. Yeah. And, it's interesting that you mentioned how popular glucosamine is in the veterinary space. It is true. However, people are actually moving away from it. More and more veterinarians, whether specialists or general practitioners, are starting to recommend newer ingredients. And in human medicine, glucosamine and chondroitin isn't really used anymore either. It's mostly collagen, for example, omega-3s, oils. And so I think that trend is also something we will see more frequently in veterinary medicine. And we're, on a mission to make people aware that other ingredients, newer, with more robust data and scientific backing, are available. Because if you're going to buy something, might as well buy something with studies to support the benefits. And if those studies can be objective, it's even better.
Yeah. Instead of just throwing your money away and then your animal's not doing any better, and that's absolutely not what we want. So you were saying somebody was, I'm not sure if that was a question. You were just saying that you have you have 14-year-old German short-haired pointer lover, so that's not a surprise. He's still doing pretty good. A bit stiff getting up sometimes, but he still goes to the park every other day. Well, that's great. I'm sure he loves going to the park. So, I actually have a little bit of a story because Dr. Christine and I somehow on, social media met through some site, and I had an opportunity to start trying out Jope. And I don't have a ground force plate, but I can observe and kind of feel my pets out and know them very well. And I have a little video. Unfortunately, I don't have a before and after. I didn't have time to go back and try to find a picture. I'm not sure I would have. A video of my dog going from lying down to standing. I'm not sure if I have something direct like that. I probably do somewhere, but my files are a mess. So I was able to see a change in my dog Cheyenne. I'm gonna play you guys a little picture of her. That's a little offer we have. We'll talk about in a minute. But this is her. Well, let's go backward because that goes by pretty quick. So she starts down on the ground, and then this is her just kind of like popping up. Now she was starting to do this thing where she would be lying on the ground, and then when she got up, she could get up, but I could see like this little bit of like stiffness. And as I said, actually she's not 9. I like to take years off of them. She's 10. She's gonna be 11. I'm totally like in fantasy land. She's 5.
She was born yesterday, actually.
Yes, exactly.
She's a baby.
She's a baby. I call her a baby all the time. But I can just say from my observation that I did notice a difference in her. And so for what that's worth, I want to just say that by giving her that, I think I have been giving it to her now for about 3 months. And I'm not sure when the switch happened, but I think that I checked back in with you. I don't know. Would you say a month? A month and a half. Yeah.
About.
And by then I had definitely noticed a difference. It was probably a little bit before that. So, yeah, and we all do. Just make up anything. So we did want to mention, are there any questions that I've missed? I just want to take a look here. So yeah, it's so painful to lose animals. It is. That's what we're here for. We're trying to come up with, anything we can do here on this channel to, extend their lives or help, make their lives better. That's what we want to aim for. So, and make our relationships better with them. And when they're feeling better, I think, all in all, it helps with our relationships because we can just bond better with them. We can take them out more. We can play with them more, do more with them. So what supplements? So what supplement is she on? So that's what I was about to get to. So this is what we're talking about, is the supplement Jope, which has these ingredients. This is the website for Jope. Joy of Pets this is Dr. Christine's company that she co-founded with somebody.
Dr. Jeremy.
Dr. Jeremy. Okay.
Another veterinarian too.
Hi, Dr. Jeremy. And actually, we have a nice special offer for anyone. We have a nice $10 off code if you'd like to try Jope. You have the link here. I think Mel Mac's going to put it in the chat too. You can either just go to petjope.com and put the coupon code ANN29. There's also a full link that will take you straight there. So it's an affiliate, so I do get a little bit of a benefit from that, but I would be talking about it anyway, even if I didn't, because I did see a difference. And anything I say this all the time. If I talk about any product on here or a method or what have you, I'm not going to say that it's beneficial if I haven't tried it myself. So, well, that's awesome that your dog plays Frisbee at 14. That's fantastic. So please go there, try out Jope. And, I'm wondering, is there anything else that I'm really fascinated that there's been this switch, knowing these ingredients that you've talked about, the UC2 collagen, the omegas. And also I will say that they love the taste of it. I think it's chicken flavored, it says.
So it is vegan, actually, chicken flavor. So there's no meat in our chews. And we did make this so every animal, whether allergic to a specific type of meat, would be able to benefit from our supplement.
Oh, I didn't realize that. Okay.
Mm.
That's
so
wonderful.
The chicken flavor is vegan.
Okay, wonderful. That's great. And, my pets love it. They get excited about it when I get the little thing out. So Yeah, so that's in the chat, the coupon code and the link, and I have it in the description for the show too, if you want to check it out. And let us know. We'd love to hear from people, like how it's gone for you if you try it. So is there anything that you think that we haven't touched on that you think we need to talk about more when it comes to pet health and pet joint health and all this good stuff?
Well, I think it is important to do your own research. Obviously, I'm mostly going to focus on like joint health and the joint supplement category because that's what I've been doing for the past 3 years, and I am truly passionate about it. So, doing your research, I think there's so many products out there on the market. It is sometimes hard to wrap your head around it. So if you're currently using a supplement and you want to know if it's the right supplement for your dog, I think there's ways to do that, and you should identify what matters to you, but also I would highly recommend trying to identify which are the active ingredients and do some research to see if the active ingredients have studies supporting efficacy. Unfortunately, probably 95% of the products out there have glucosamine and chondroitin, which honestly is not something I would recommend. And I think there's other ingredients, other supplement out there with studies that show it can help your dog. So why, buy something that has been shown not to be as effective? Exactly. When it comes to choosing the right ingredients, we selected a combination that had a complementary mode of action. So we have 3 active ingredients. They work in a complementary way to support joint health, and their benefits. There's 2 benefits to the combination we have. Number 1, it helps support cartilage production. And number 2, it also helps with redirecting the immune system to support a healthy inflammatory response. So, one of the analogy I like to use, and I think is easy for everybody to understand, is that when it comes to joint health, and especially in the case of osteoarthritis, where the joint is affected, it's kind of like if you have a house, which is the joint, that is on fire, and the fire represents the inflammation in the joint. So when you're thinking about how ingredients work to help the burning house or the burning joint, there's really a way to think about it is like if you want the house to remain and to stay present and as healthy as possible, you want to stop the fire. In the case of glucosamine and chondroitin, the thought is it brings building blocks to rebuild the house. So imagine a burning house and you're bringing bricks to help rebuild it. If you haven't stopped the fire, that won't be a good approach. With our ingredients, they actually act to redirect the immune system and inflammation. So instead of having a burning fire, you're decreasing that fire so that you can then bring the building blocks to help repair the house. So that is like a very simplified analogy, but I hope it does help. That is why glucosamine and chondroitin they're not as effective as other ingredients. For example, omega-3s, EPA, DHA, UC2, green lip mussel. So those are ingredients I would recommend selecting. And then if you're curious about the quality of the supplements you're getting as well, you should be able to email the company and ask them, for example, do they do third-party lab testing for their active ingredients? So for example, we test every single one of our batches by a third-party lab to make sure that what we have on our label, so the 20 milligram of UC2, 50 milligram of curcumin, and 200 milligram of omega-3s are present in our chew. So that's the minimum guaranteed amount we have. And if a batch doesn't pass that test, we do not sell it. So we go back to the manufacturing plant and we do a new batch. We are able to provide that certificate upon request. So if that's something, a company you're currently buying a supplement for does not want to give you, I would ask why, for example. As a consumer, you are entitled to know. I would also look for products made in the US just because the manufacturing standards are higher here. And again, I wouldn't be afraid to ask if it's not available on the website, where it's being produced. And obviously, talking to people, reading reviews, asking questions, contacting the customer care team, just making sure that, if you're going to spend money, you have the right to know what you're spending your money on.
Absolutely. That's all such good advice. We have to really dig and look at these labels before we give this stuff to our animals.
Yeah.
somebody, they have a question here. What do you think of the
Librella shots, I think,
shots?
right?
Yeah.
So, interesting. So Librella, actually, so I'm a French veterinarian, and in France, we had Librella for longer than it's been available in the US. My feeling with Librella is that you should tread carefully and choose the right cases to use it. So what Librella does is that it's actually monoclonal antibody, which binds to basically a molecule which is responsible for making us feel pain. So basically, when you give the Librella shot, it binds to that molecule and it prevents your dog from feeling pain. So in certain cases, it can be very effective in managing quality of life if your dog is really painful. And for example, non-steroidal medication isn't helping, supplements aren't helping, massages aren't helping. So Librella is a great tool in certain cases to improve quality of life linked to pain. What it doesn't do is that it doesn't prevent inflammation. So that burning house we were talking about, it is still burning. But what happens is that your dog isn't feeling that burn and is not feeling the pain. So if you're giving Librella, you should also try to address the burning house or the joint that is inflamed, because otherwise you're really kind of just covering the bigger issue. So I think Librella is great when it comes to improving quality of life, but I do not advocate for using it as an end-all, mean-all. And is that how you say it? End-all, mean-all?
End-all, be-all.
Be-all,
Yeah.
be-all, sorry. And I think it's important to also just double check with your veterinarians. The reports I believe that you're referring to with the bad side effects especially occur if there's neurological symptoms involved. So in certain cases, like senior dogs, it can be challenging to differentiate mobility issues due to orthopedic conditions versus neurological diseases. And when you prescribe Librella without making that distinction and without evaluating your patient properly, that is where you can have serious side effects. So I think it's, if your dog is highly painful and your veterinarian recommends Librella, it is worth considering. After doing orthopedic exam, neurological examination too, and you do have to, weigh the benefits versus the potential risk. But if your dog, like at some point, Pepsi, when I was trying to help him, he could barely stand up and he could barely walk. So if I hadn't been able to help him through other means, that would have been a case I would have considered it, because the alternative was, helping him or having to maybe make a very difficult decision. And you're not always ready to do that.
Yeah.
So I hope that answers. I know it's a bit of a long response.
No, it's very helpful. It warrants a long response because it. And it's what you're saying. It's like a Band-Aid for a bigger problem.
Yeah.
Okay.
And they do not give Librella to humans. I love these questions. So
don't go
actually,
taking
that's
your
very
dog's
interesting.
Librella.
There was a study done in human, but with Librella in humans. So it wasn't called Librella, but it was a similar type of molecule. And when they gave it to humans, they saw really bad side effects, which were not conducive to bringing to market this product. And so I would say that raises for me some reservation, and that's again why I would personally, as a veterinarian, use Librella when applicable and when the benefit would outweigh the potential risk.
Got it. I'm interested too, just in the fact that in using these ingredients, like you have talked about in Jope and inflammation, it seems like not just for joint health that would be beneficial, but for other systems of the body. And do you find that there's, I don't know, I mean, maybe you just kind of want to stick to what it's marketed for, but but inflammation is such a big issue. Like it seems to be at the underlying cause of so many things that go wrong.
So the studies that we use and that we can quote are specifically focused on mobility. So I wouldn't be able to say, studies showed that UC2 was able to improve comfort in dogs with other inflammatory disorders or diseases. We do have anecdotal reports of, for example, great coat, great bowel movements, so other like pleasant side effects. Whether I feel comfortable marketing it that way, I think not. But basically, the nice part is that, yes, because we have this fish oil, because we have this collagen, because we have the curcumin, let's say that I am not surprised that some of those side effects are actually positive versus unwanted.
Yeah.
So that's nice.
Yeah, absolutely. I mean, I'm making all these connections in my mind, but I won't go there. Just inflammation is such a thing with so many things. So it seems like it would be having some other effects. But do you think you're going to be doing some studies to see if it helps in other areas? Or
we actually are trying to do a little pilot study with a dermatologist, because we had enough people tell us that it seemed to improve like their dogs over coat health, skin health, less itching. So we were curious to see if on a moderately itchy dog, our chews could help. So far, I don't believe we've been able to enroll a patient, but we would love to have some data.
That's really interesting. You know why? Because in the spring, itchiness becomes an issue with my dogs. And I will say that last year I started giving them
Apocal?
colostrum. And it did seem to help, but it wasn't like 100%. I mean, it definitely helped. But this year, I didn't really even think about this. They haven't had any itchy at all. Not any. There's been no signs of it. So that's really interesting. I never thought about it. I didn't make the connection. But I mean,
I don't want to say too much because, it's like, I'm obviously like, thrilled to hear it. And I do, like, again, you're not the only one. So I feel like it's definitely a potential, like, nice side effect. Mm-hmm. So maybe keep an eye out, Anne, and let us know. But...
Yeah, absolutely. And I mean, I would have posted a picture of my dog Kane, but I didn't think it was fair to post him because he has a chronic, so before we got him, he was, there was a neglect situation where he got caught in a fence and his shoulder and elbow got dislocated and they didn't fix it. And then it led to them having to do this big surgery on it and like fuse it. So he kind of has this permanent limp that gets better and worse, just depending on, he could go out in like the winter on some ice and it might get a little bit worse, whatever. So I just give this to him because we want to do everything we can for him. I do laser on him and massage and acupressure, but, it would be difficult for me to have shown it before and after of him. He's starting to make, he's talking.
He knows we're talking about.
Yeah. He's like, I wanted my video up there. But I think it's just good to know that he's getting, I don't know if people can hear him because I have earphones in, but we
can hear him a little
making
bit.
Noise. Okay. Yeah, we're talking about you, buddy. But I like just knowing that he's, at least it's potentially helping to help with the progression of the consequences of this whole situation.
Yes, and actually that's what I was referring earlier. Like, even if it's kind of hard to know, but the reason we really like UC2 collagen again is that there's also studies in dogs and in humans showing the benefit, even for healthy patients or canine patients. And so, I do like it. And basically 2 studies in dogs showed that it helped improve inflammatory marker associated to normal daily exercise. And it improved recovery and performance as well. And so, if you're not sure if it's helping, I mean, there are, obviously it can be hard, but if you feel like it's better to be proactive, I do like UC2 because of kind of that extensive coverage we get where it seems to be helping, according to studies, young dogs that are healthy but might just be a bit more achy after a very intense day of activity. And then also our more senior dogs that actually have already established joint disease and osteoarthritis, and they're able to be more comfortable. And that is reflected like on our website. If you go and read the reviews, you'll see there's people really from like coming at it from every angle, either prevention or curative, and helping improve quality of life. And by curative, I really mean that the disease is already there, but they're trying to address it and adding Jope to the treatment plan. And obviously, we're not curing osteoarthritis, or I'd be a very rich veterinarian right now, and life would be great.
Yeah, well, hey, you never know, but what's coming. But what about kitty cats? Can we give this to them?
Supplements?
Can they take this?
So UC2, so cats are, I love cats, but it is always very hard to talk in using scientific evidence or data because there's so few studies done in cats. So UC2, there's no studies in cats. I do want to give this as a disclaimer. However, anecdotal data show it benefits cats. And the reason I think that is accurate is because UC2 has actually been shown to be effective in human, dogs, and horses. And it has basically type 2 collagen, which is a collagen present in any animal that has cartilage. And so in theory, it should help any animal that has cartilage, and that includes our cats. Okay. So we have veterinarians actually using it in their cats, and they give them 1 Jope chew a day. I will say palatability was meant for dogs. So if your cat doesn't want to eat our chews, I wouldn't be surprised. But you can mix it with the food and give it to your cat that way, like in wet food. Some cats will eat it if you just break it up a little bit because there is fish oil in there, so they might like the smell. But I would encourage, if you want to try it, to certainly it is safe. But I do not guarantee that your cat will eat it, just because of the vegan chicken flavor we were talking about. Right. Apparently, it's not our cat's favorite.
Yeah, I tried it with one of my cats. I need to try it with the other one. She's 4, but she's a big girl, so she probably should be on something. The first one, I gave it to her not in her food. I should try it in her food because you just can't get anything by her. She's
tricky.
She's tricky. Yeah.
That's very hard.
Yeah. Even things she likes, she doesn't want to acknowledge liking. It's cats. And so people can get, where can they get Jope? We did show the website, but is that the primary place?
Well, on our website, using your code is probably a great way to do it. They thank you for, making them aware of Jope. And we also have a special discount as well. So, that is nice. And we have 100% satisfaction guarantee. So that means if you try Jope and you're not satisfied for any reason, we basically don't think you should pay for something you're not happy with, especially because we're in the business of helping animals and not just keeping your money. So if you're not happy, you email us and you get a refund. If the bag is open, we ask to donate it to a local shelter or another dog in need. And if it's not open, we can ask you to send the bag back. And then we are also available in select veterinary practices. So we are partnered right now with 50 animal hospitals, hoping to grow this year. So if your veterinarian does not know about Jope, they can email me. Okay. If your veterinarian does already carry Jope, you can get it from them. And then we are on Amazon, but we are the only reseller on Amazon. So I would prefer if you went on our website. Amazon is just a bit trickier for us. But if you really prefer Amazon, we are on Amazon, and same quality product and everything. So those are really the 3 places, I guess, where you can get Jope.
Okay. And I'm sure she is. Oreo is the queen of the house.
Very cute.
They do.
I love the name Oreo.
It's cute. And is there anything that we didn't touch on that you feel like is important that I might have missed?
No, I think, Anne, you've done a great job covering everything and remembering.
Thank you. Well, it's written down. That's the key.
Yeah, I mean, have to stay organized. No, unless there's other questions, I think, we've covered everything. If there's anything else that somebody wants to inquire about, more than happy to answer. And I'm happy to keep the subject or the question very broad. It can be on anything I could help out with tonight. I'd be happy to. It doesn't have to be just supplements or joint health.
Okay, yeah. If anyone else is in there and they just have a question about their pet, I know there's people watching who don't always. They're not brave enough to be in the chat, but
it's okay. Next, if they watch in replay or if they want to email us too, like any email on our website, it's contact@petjope.com. And if you want to address it to me, Dr. Christine, our team members will forward it my way, and I'm more than happy to answer.
Oh, thank you. So, that's wonderful. I appreciate that.
If that's helpful.
Thank you. All right. Well, I'm not seeing any additional questions because I think you really covered a lot of information here that is really important. And, I think the takeaway is start young, start paying attention to this much maybe earlier than one would think.
You can actually start, I guess that is a great point. I think you should start caring about joint health as soon as you get a dog or a cat. And joints are something to really be cherished and protected, because once that cartilage is gone, there's no bringing it back. So even for us, I think it's very important to just be mindful of our joints and take good care of them.
Yeah, absolutely. Great advice. Thank you so much, everybody. And, we always appreciate your comments. So if there's anything you want to mention, we'd love to know your experiences and more about your pets. And Dr. Christine, please stick around when we go off. And if you'd like more information about any of my classes or services, I do have in the outro a little QR code that'll take you to my website. There's a free class on there too for animal communication if you want to get started with that. And that all being said, everybody, thank you so much for watching. I really do appreciate you, and God bless. Thank you.
Listen close. Rub my belly.